Hello folks, Vente here once again at Vente Pain Relief Clinic with another one of my health tips. Once again, we have Skelly as our demo, and as you can see, he's got tape on his mid-back here, and we're going to talk about that in a little bit. Have you ever wondered why every once in a while your neck goes into spasm? You know, you might find every few months or so, all of a sudden you can't move your neck, you can't turn it. We're going to talk about that today. This is an example of what could happen with some people. It doesn't happen to everyone, but I've seen this presentation with certain patients that come in with neck spasms. They come in because they've had it for a few days. They can't even turn their neck. They have to turn their whole body. I think many of us have had that issue where we have to turn our whole torso as opposed to turning our neck. Right, so now the reason why that could be happening, and this usually happens to people that do a lot of prolonged sitting, like for example, sitting in front of the desk as part of your job. You might be sitting there 8 to 10 hours a day. In fact, if it is a very, very busy period at work, you might be sitting at home doing the same thing too and adding extra hours sitting down. So what happens is over time, this area here, the thoracic spine, your mid-back right here, the different segments, as you can see, this black area here, the different segments of the spine, they can become compressed. Some of the muscles in here, the small ones, such as a small muscle called the multifidus, which runs up and down your spine, it can become very, very tight and basically lock things in place. And I know it's locked in place because when the person's lying on their stomach, and I'm pushing down or I'm trying to move the spine, if I'm doing certain techniques and assessments, I'll find that these segments don't move as well. There should be a bit of give, about 1 millimeter or so side to side, and a bit of give going towards the table when I'm pushing down. And when I find that it's not moving, it indicates to me that this area, the muscles, the smaller muscles in here are probably in spasm. And what happens is, because they're in spasm, it compresses everything. So everything's locked in place. Now, as a general rule with the spine moves together, right? So even though you're moving your neck, there's some motion that happens at the thoracic spine, the mid-back here, and the lower back. It may not be as significant a motion of the neck, like if you're turning your head, but there is some motion when you're rotating. So if certain segments are not moving well, what happens is there's more load put on other segments to do that certain motion. So for example, if you're trying to rotate your head and this is very, very, very tight and compressed, this area here, what will happen is the segments of the cervical spine, your neck here, have to move more to compensate for the lack of motion that occurs at these points here on the mid-back. And when that happens, what generally will happen is that the muscles around the area, around the neck, will go into spasm. So if there's excessive motion, there tends to be more tightness that occurs around the neck. So the person starts noticing, oh, they've got neck pain, when in fact, it's more symptomatic of something happening further down. And like I said, I know that this is the case because as soon as I start mobilizing this, as soon as I start moving these segments here, the person actually feels more comfortable rotating their head as opposed to rotating their entire body to look behind them, or you know, when they're driving, looking to the right side, checking their blind spot, so on and so forth. So again, just as a repeat, basically sitting down for prolonged periods. If you're in that period right now at work where you're doing more sitting down to finish off some work, this area can become very tight and compressed. And then all of a sudden, it's not moving well, and then because of that, there's going to be more excessive motion around the cervical spine, around your neck, and because of that, there's a tendency for spasms to occur around the neck, and therefore you start noticing that you can't turn your head properly because the muscles are so tight and are locking things in place. So that's something to look at. It doesn't happen with everyone, but like I said, every once in a while I get somebody coming in here, and the first thing I will notice is that their thoracic spine, their mid-back does not move too well. So if you've got questions regarding this or neck spasms in general, feel free to give us a call at 416-644-8894 or email us at admin@ventepainrelief.ca. Also, next week on our health tip, I'm going to talk about the cold and does it cause pain or certain tightness. So that'll be an interesting one. Remember, our premieres for our health tips are every Monday at 5:30 p.m. Have yourself a great day. Vente here, once again at Vente Pain Relief Clinic.